We are very excited to have three wonderful professionals from the health industry in Greenville, the community organization, health organizations. And we're going to start off with Miss Amy Connor, who is with New Horizons Health Services.
Thank you so much for the opportunity to be here today. Again, I'm Amy Connor with New Horizon Family Health Services, and I'm going to attempt to share my screen so you can see a little presentation that I have. Gina, are you able to see my screen? Excellent. So we are a community health center, which really means that we're a family doctor. And we are able to serve everyone in the community, whether or not they have health insurance. We've been in Greenville County since 1992, seeing about 23,000 patients each year. And we offer lots of different services, and I'll review those in a moment as we go along. Our mission is to provide quality, affordable, compassionate, patient-centered health care to improve the health of the communities that we serve. And here are our medical offices. The photo is of our medical office in Greenville on West Ferris Road. That's right across from the hospital. And that is going to be the location that most folks are probably the most familiar with. We've also got a location in Greer and also in Travelers Rest. So those are our medical offices. We also provide dental services. And again, whether or not you have health insurance or dental insurance rather, we are able to provide those services. That's a photo of our dental office, as well as we also have a mobile dental unit. And that is actually getting ready to go back out into the community, hopefully early next year. That has been, thank you, Gina, that has been out of service during the pandemic, but it will be in service again very soon. And that dental office is off of West Ferris Road, also behind the Burger King. Lots of people know where the Burger King is. So here is a list of some of our services. Again, we're a primary medical doctor, a family doctor. We just mentioned that we have family dental care, and that's for all ages. We have pediatric services at all of our offices, both medical and dental. So we're going to be handling checkups, sick visits, immunizations, vaccinations, as well as things like sports physicals. We've got pediatric services at all offices, and we have a couple of pediatricians that only deal with just pediatric services. We also have behavioral health services. So we're able to help with issues such as anxiety, depression, different items like that. And that's in all of our offices. Our medical offices also have pharmacies on site. And we're able to offer low or in some cases free prescription medications to our patients. You're able to get those the very same day as your appointment. So we want to make it as convenient as possible. We're able to manage chronic diseases, things like blood pressure, diabetes. We've got a staff of individuals. Gina, I don't know. Okay. I didn't know if you could see that as well, but admit. We've got a staff of individuals who are able to help people learn how to check their blood pressure or how to eat maybe a little different to manage their diabetes. We have a full-time staff of medical interpreters at all of our offices. When you come in, just ask for an interpreter and someone will be right there to help you, and they'll kind of come along with you on your appointment to be able to help you communicate with your doctor and your nurse. We have things like nutrition counseling, again, health education, lab services, and we also have care management services, and that's a team of social workers. So if a patient or family might have some challenges with food insecurity or housing or transportation, or even employment. We don't offer those services, but we can connect you and help you connect with other organizations in our community that can help you with those challenges. So if you're in to see our doctor, they'll ask you some questions, but just be sure that they're aware of any kind of challenges like this that you are facing so that we can help. We can also help you sign up for insurance. Right now is the Affordable Care Act Health Insurance Marketplace Plan. I know that's a mouthful for the interpreter. The open enrollment period. So this is if you don't have health insurance, we can help you identify what plan might be the best for you and your family. All you have to do, you can either walk in one of our offices or call this number to make an appointment. It's completely free, this assistance, and you do not even need to be our patient to get this type of assistance. We just want to help connect you with health insurance. So be sure and do that before January the 15th if you are needing insurance. This team of folks can also help you identify if you or your child may be eligible for Medicaid and help enroll you in Medicaid as well. So just come in our medical offices or call that phone number. In addition to insurance, we accept health insurance, Medicaid, Medicare, but then we also are able to offer a discount for people that may not have health insurance. This information is based on your household size and income. So when you would come into our office, you would be asked to complete some paperwork to provide some payment stubs so that we can see your income. And then based on that information, we are able to identify what your discount would be, what you would be paying for your services that day. A couple of other programs that I wanted to mention briefly. We have a healthcare for the homeless program where we're able to provide the same services that we provide in-house to folks out into the community. We also know that individuals experiencing homelessness may always have different situations. So you may not have a permanent home, permanent housing. Perhaps a family is bunking or living temporarily with a relative or in a hotel. So these types of situations may qualify families to be able to be eligible for the healthcare for the homeless program. So if families are in this type of situation, you would want to mention this to the individuals when you're making your appointment, and also mention it to your doctor or when you come in to check in for your appointment. And that could qualify families for additional assistance. We also have a medical respite program, and that's in a couple of shelters in Greenville. This is for individuals who are experiencing homelessness, who have been in the hospital and are discharged, but they don't have a secure place to go and recover. At times, this may also look like someone who previously had housing, but because of their sickness, they're no longer able to maintain that housing. So there are different situations that we can help in to be able to provide a space for people to receive medical support and care while they're recuperating after the hospital. So I just wanted to mention that program as well. Our Ryan White program provides services and treatment for individuals living with HIV or AIDS. We provide all different types of assistance and support for these individuals. And we also are able to offer HIV prevention. You may have heard of PrEP, and that's for folks who are at risk of getting HIV. And so this is a 1 pill a day prevention method that's highly effective. So for individuals who are interested in learning more, just call our office and we're able to provide information about these services. We just started a health and wellness program at the Phyllis Wheatley Center. Our next session is tomorrow night at 7, and this is for middle school students. We had a session last month on nutrition. Tomorrow night's session is on germs and hygiene. And then we'll have one session each month on different topics such as nutrition or careers or safety, things that middle school students would need to know about health and wellness. So if you have a middle school student who might be interested in this type of information or you want to join us, you can just call the Phyllis Wheatley Center or even show up or, keep an eye out on our website for future dates. We would love for you to join us. And that is the end of my presentation. Thank you so much for the opportunity to be here. And I would love to answer any questions if we have time or at the end, or you can just reach out to me at the email listed.
Thank you so much, Amy. Does anybody have any specific questions to ask Amy about the many resources and services that are available through New Horizons Health Services?
I do have a question, sorry, from the medical aspect, Amy. For the HIV PrEP patients, do y'all still do a sliding scale? I know that's extremely expensive.
Yes. And in fact, sorry, I'm speaking too fast. In some cases, we are able to provide PrEP for free.
Excellent question. Thanks, Holly.
And Holly, if you need more information on PrEP, I'd be happy to drop that by or get that to you. We have information cards.
Yeah, I actually work in the adolescent clinic, so I actually prescribe PrEP, but I know that there are a lot of, it's super expensive. So it comes, that's nice to know it's in our community.
Thank you again, Amy. It's always so good to have you on the meetings and to learn about the great work that New Horizons is doing.
Thank you so much.
So next, we'll have Miss Holly Grady, and she is a nurse practitioner with the Prisma school-based health clinics. She is very dedicated to our students and the children in the On Track community. Welcome, Holly.
All right. So just a little bit about me and our program. I am Holly Grady. I am a pediatric nurse practitioner with Prisma. I serve as a lead nurse practitioner over the school-based health centers. I have been working in this role for about 6 years, but have about 18 years of experience as a pediatric nurse practitioner. About 2 years ago, if you see this little thing, I received a primary care mental health specialist certification as well, because after being in this program for about 6 years, I realized there was a lot of kids really struggling with some mental health and needed to get a little bit more education to be able to provide the best care for these students. So a lot of you are probably wondering what school-based health is and why it's really needed. Across the country, it looks different. There's a lot of different school-based health centers. Sometimes they perform well child exams. We do not do well child exams. We are basically there to do the acute or sick care visits. So the strep throats, the ear infections, the rashes, mental health care. We offer sports physicals. We also work with other medical providers in the community to provide that chronic care management. For example, if your student has asthma and is followed by a pulmonologist at Children's Hospital, we work with your provider. We do not replace that provider to help them at school. And then we also do a partnership with DHEC for rising 7th graders to try to get the kids vaccinated in 6th grade so that they can start school on time their 7th grade year. Another thing, the difference between school-based health and a regular medical clinic is our clinic is actually inside the school. So we call it a traditional medical clinic inside a non-traditional setting. Most of our clinics are within the school nurse's office. We have a couple of spaces that are individual. For example, at Berea Middle and at Sullivan Center, we have our own clinic space. So where are we? Physically, we started with On Track Greenville at Berea Middle, Lakeview Middle, Greenville Early College, and Tanglewood Middle School. We offer telehealth program and physical care at those schools. So if I am not physically at one of the schools, or one of the two physicians I work with are not physically present, those nurses are trained to be able to contact us and do a virtual care visit for any type of acute illness. Again, strep throat, rashes, cuts, ear pain. We've added, since starting 7 years ago, Sullivan High School Alternative Program last year, Bonds Middle School Alternative Program, Donaldson Middle School Alternative Program, and West Greenville Middle School Alternative Program this school year. And then we offer that telehealth component at Berea Elementary, Sue Cleveland Elementary, Carolina High, and we're adding Berea High this school year. The reason why we're not physically present in all the schools is because our team is extremely small. I serve in most of the schools with a medical assistant most of the days. I do have two physicians that serve, one in Lakeview Middle and the other at the alternative high school. So again, when I talk about what we actually do in the schools, a lot of times kids are referred to us because a teacher or an administrator or even a parent is witnessing something that is different in them now than they remember in elementary school. So is it anxiety or depression, or do they have ADHD that's gone untreated? So those kids, we actually do those screenings. We do the ADHD screenings, the anxiety screenings, the depression screenings. And I don't know if y'all have heard, but, with the increase in depression and in anxiety over the past few years in this middle school and high school population, we've also had a huge increase in eating disorders as well. We offer the acute care services. So again, for those services, we do actually carry over-the-counter medication. So if your child is seen in the school and we need to give them cough drops or cough syrup or ibuprofen or Tylenol, something to basically make them more comfortable to be able to attend school that day, we have a form that you can sign giving us permission to give that over-the-counter medication to your child while at school. If we are offering telehealth services, the school nurses also have that medication if we have seen your student by telehealth. We also, since we are a medical clinic, if we have diagnosed somebody with a illness or something that requires an antibiotic or an inhaler or anything like that, we can actually send in the electronic prescription. So you would just have to go to the pharmacy to pick it up. Again, follow-up care. If we have diagnosed somebody with ADHD, we can do those ADHD visits at the school. Same with anxiety, depression, those types of things. Another huge thing that we do is put students with the resources they need in the community. So do they need a primary medical home so that they can get their vaccines and see them for their yearly visits? Do they need to be referred out to either counseling, Greenville Mental Health, or a medical specialist? We work a lot as well with pediatric support services. They have a medical legal partnership that can help you make sure that your child is getting the schooling and education they need, and there's not a health component. For example, if you are renting a home that has black mold in it and your child has asthma and you have the person that owns the home is not willing to take care of the black mold, that's when we would need to get somebody involved to make sure your child has what they need. And we also use New Horizons a whole lot and Unity on Main for referrals. The goals of this program is like On Track Greenville's goals. We want to promote resiliency in these students. I know a lot of these kids have some trauma in their lives, or they deal with things that we wouldn't understand. And we want to give them all of the resources they need to be successful in life and graduate from high school. We want to remove those barriers for you and your student. So we want to remove that transportation barrier. If you do not have transportation to get to the doctor's office, it's much easier to see a student at school because they're already there because of the buses. Finances, that's huge. For those students that do not have insurance, we are grant funded. So the parents will not get a bill from us if we see the student. We will bill your insurance if you do have insurance, but there will never be a bill to the patient or the parent. Also, that time barrier. Our goal is to keep these kids on track to graduation. So they really need to be in the classroom and healthy. So if we can pull them out for a 30 or 45-minute visit at the school, it prevents them from having a half a day or a day missed because of a doctor's appointment. Now, from you as a parent, we do have a consent process. It is getting a little bit easier, but is always a little bit overwhelming. These consents are available in English and in Spanish. And we have tried to highlight every portion of the consent that is needed. Because you are not at school with your student, we like to have this in hand so you know that we know that you have given permission for us to see your student. After this consent is signed the first year, for those of you that are parents of students that have been in schools for the past couple of years, this is new. We have a one-page rolling consent that they can sign the bottom of that page and does not have to sign the full consent packet every year after that first year. At school, your school nurse and your school on-track facilitators have these consents. If you reach out to your parent liaisons, I'm sure that they can get the consents as well. And we've tried to send them out to all sixth graders this school year. So anybody can refer to the school-based health center if it is a parent or a teacher or on-track or staff facilitators, school nurse, or even the student themselves can come by. Do know that we will not see your student without talking to you. We try to contact every parent before or after or both for seeing your students. Does anybody have any questions?
Holly, because we do have some international parents on the line, would you describe what a nurse practitioner is so that they understand all the credentials and the training that you've had?
Okay. So a nurse practitioner is an advanced practice nurse. We have had a master's degree versus the 2 or 4 year RN degrees. We are able to prescribe medications just like a physician does, and we're allowed to see patients without a physician actually on property with us. We do work hand in hand with physicians. So if we have questions, we have that backup to call and talk with. My backup is actually Dr. Cease and Dr. Guyton, who are actually the other 2 providers within the school-based health center. I also have a controlled substance license, meaning if I were to diagnose your student with ADHD, I could write for those medications. So we're basically like an extension of the physicians. Does that make sense, Gina? Okay.
Yes, thank you so much. I know that there's a lot of experience and training that you've had and that your credentials are very strong. And so I wanted to be sure that families understand how qualified and trained that you are.
Well, and another thing that is very confusing at times is the difference between us and the school nurse, because we are oftentimes in the nurse's office with a school nurse. A lot of times they cannot give your student medications unless you have filled out the forms or unless you bring the forms with you or the medication with you to school and administer it yourself. We also can wrap ankles, put antibiotic ointments and hydrocortisone cream and different types of ointments on rashes or burns or cuts, things that the school nurses are not allowed to do because of their restrictions within the district.
Thank you so much. It looks like one of our parents has a question that you would like to ask you. And so say, and if you will please tell what your question is to Christine, she will be able to, or Maribel may be able to go ahead and pose that in the English room.
So I do see that there's a question that says, are you at the schools every day? So our schedule is different. We are offering telehealth visits every day of the week. I am physically present at Berea Middle on Mondays, at Tanglewood Middle on Tuesdays. We have presence at Sullivan Alternative School on Wednesdays. Lakeview Middle has in-person care on Thursdays, as well as the middle school alternative programs on Thursdays. So if we're not physically present, we are there for those acute care visits. Also for those sports physicals, we set those dates in advance. So there will be information that comes home for you to fill out that consent packet, in addition to a history form that we have to have prior to doing the sports physicals. And if any of y'all do have sixth graders, there is a separate consent packet for the vaccine clinics. Just because it is a federal funded program, we have to have additional consents. But if y'all have any questions, there's my email. Please contact me.
Thank you, Holly, for all the things that you do for our students. We're really grateful for everything that you do.
Thank you.
We would like to re-welcome Jenny Ceballos and Elizabeth Sarat from Unity Health on Main.
Hi guys, sorry, I'm like the least tech savvy person, so.
Okay, we're just going to take a little pause right now so that we can get a better connection for Jenny and Elizabeth. Unity Health on Main is a great organization. Their services are wonderful, just like all of the good work that Amy and Holly do. So it's really important for us to share this opportunity to learn more about Unity Health on Main. So as I'm looking at the first page of their presentation, the consent forms are another thing that is needed here at Unity Health on Main. And is that something that all of our families understand the importance or why the consent to treat form is and know exactly what that is?
We called in, we can hear you, but
okay,
I don't think you can hear us.
Yeah, we can hear you now. Yes.
So thank you all for being patient with us. So like Gina was saying, we are Unity Health on Main, and we are a community health center. And we were founded in 2017 out of a Greenville survey that identified the need for pediatric care in the Greenville community, mainly recognized in that White Horse Road corridor that the children in those schools did not have primary care providers and were missing many of their routine vaccines and well child checks. And after we began seeing our pediatric patients, we recognized the need to begin extending services to parents, and then that has extended even further, and we now see patients all the way from birth to death. 58% of our patients are currently pediatric, and 42% are adult. I'm going to let Jenny go over our mission and our focus with regards to who and why we serve.
All right, so Unity Health on Main provides culturally competent primary and mental health care services to underserved and vulnerable populations in the upstate of South Carolina. Without a regard of the ability to pay, of course, we do take like the private insurance, Medicaid, Medicare. We also have a sliding scale program where they will just have to bring their income as well. And it depends on the household as well, how many members are in the household. Our mission actually is to improve the overall health and well-being of the community we're actually currently serving right now. For some of our services, I'm going to let Elizabeth mention them.
Okay. So since we are speaking mainly to parents, I want to make sure everyone is aware of the services we do provide for pediatrics. So we are a VFC provider for vaccines. So what that means is even if you are not insured or if your child has Medicaid, we can provide you and your child with the necessary vaccines to keep them healthy and to keep them in school. And we are able to make those appointments pretty rapidly. In general, we can get you in fairly quickly. We also see children for their routine well child checks. We also have an obesity management program where we collaborate with other community partners to help that family be healthier and to prevent long-term chronic health problems. So we can work with your child and yourself to provide nutrition education, provide food boxes with fresh fruits and vegetables. We have an exercise program that we can connect families with a free membership to the Croc Center. And then we also have once a month, someone from the Clemson Extension comes to provide food education, helps discuss healthy recipes, and that is provided in Spanish. And we also do developmental assessments in our clinic. So if you had a concern that your child was missing milestones or the teacher has come to you with a concern your child might have an attention disorder like ADHD, we can do those assessments in our office and we can prescribe appropriate medication and also refer to therapy that is appropriate for that diagnosis to help your child thrive and do well at school. We also do sick visits in our clinic, and we see those patients in our office as well. We contract with several different community organizations to provide other services. So we identified a very large need for therapeutic services, and so we have Universal Therapeutics that works with us, and we have grant funding that will help pay for those visits regardless of your ability to pay. So even if your child does not have insurance, we can help establish you on a sliding scale with them so that you and your child can receive therapy, whether that's for learning some behavioral skills to help your child with focus and attention at school, or if they've experienced trauma, they can work with a wide variety of concerns. And then again, we also contract to receive food share boxes for our families. We do have an in-house lab, and we can do a wide variety of labs if you or your child need those. And in terms of the whole family, we also provide women's health services. So we can do mammograms on site with our mobile bus that comes once a month. We do routine GYN, pap smears, birth control. We also see patients diabetes and high blood pressure. So we can see you and your family for a wide range of needs. We have provided, this is just our website, but we are located off of Main Street. So where there used to be a Bilo here, it's us and a Chinese restaurant in our facility. And we are right on several bus lines. So we are easy to access by bus or by car. We've recently extended our hours. So we are now Monday through Friday, 8 o'clock to 5 o'clock. And we did that to better serve our communities so that we could have a little bit earlier hours for those families, maybe wanting to get in before they go to work or school. And in terms of our staff, I think one thing that sets us apart is, other than myself and one of our other nurse practitioners, everyone else is bilingual. So most of our staff speak Spanish as their first language. We have one physician and one nurse practitioner that do speak Spanish, and they are able to do their visits 100% on their own Spanish. And then myself and the pediatric nurse practitioner, we use our medical assistant to help interpret within the room at the time of the visit. So we actually have interpretation on site rather than having to call in for assistance. Any questions or anything else anyone wants to know about our clinic?
I did see, Jenny and Elizabeth, that one of our families said that they go to Unity Health on Main for their care and that everybody is so kind there. Okay, so I would like to thank everyone who was part of this meeting today. Thank you to Amy Connor, to Jenny Ceballos, Elizabeth Surratt, and Holly Grady. Thank you for all that you do to keep our community healthy and safe. As you all know, there is a $25 Walmart gift card for each family that participates. And please encourage your friends and other families from your school so that we could help everybody in our community understand the important resources and services that are available. We look forward to seeing you all next month. Hope everybody has a great day. Thanks again for joining us.
Bye. Have a wonderful day.